大家出席今日。
Welcome to the press briefing. On stage, we have Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch, Center for Health Protection, and also Dr. Larry Lee, Chief Manager from Hospital Authority. Dr. Au will give us an update of the cases. Good afternoon, everyone. I'd like to report to you the number of confirmed cases as at the 5th of March yesterday. Now, we have confirmed 31,008 cases. Number 440616 to 471623. Among the 31,000 odd cases, 3,082 cases were confirmed by HA, 2,601 from CHP Public Health Laboratory. The remaining 25,325 cases from private clinics or laboratories. Only 2 cases were imported. The remaining 31,006 were local cases. In the 5th wave, we have confirmed 45,800 and 455,986 cases. Now, the Public Health Laboratory did genome analysis of 2,601 cases. 2 samples were positive to L4528, accounting for 0.08% of the samples. 2,105 cases were negative to L452R, accounting for the majority or 81.1% of the cases. The remaining 494 cases have got the analysis pending or with or undetermined because of low viral load. Now, for outbreak at homes yesterday, there were another 94 care homes with outbreaks or cases. Among them, 73 are homes for elderly persons and 21 for persons with disability, involving 844 cases. 694 persons were residents and 150 staff members. In the 5th wave of outbreak, 662 care homes have had outbreaks or cases, accounting for 83% of all the elderly or the care homes in Hong Kong, involving 13,000 residents and 3,450 staff members. For care homes for the disabled, so far 213 such cases have had cases or outbreaks, accounting for 63.6% of these homes. 3,800 residents and 1,370 staff members were involved. Now, for the number of deaths, as at yesterday, in the 5th wave, we've got 1,794 deaths. The fatality rate was 0.39%. 1,103 were male, 691 were female. Age range from 11 months to 108 years. The median age, 55 years old. And 4 cases involve children. And I'd like to supplement that yesterday I said 6. In fact, 2 were patients 19 years old. So for only 4 children cases are confirmed, and all of them were below 10 years old. For the age range 18 to 59, we've got 89 cases, accounting for 4.96 of the total number of deaths. Cases over 60, 1,696 deaths, accounting for 94.5% of all the deaths. Among them, 1,227 cases were over 80 years old. For those who are 80 or over, they account for 68.4% of the total deaths. 5 cases with age unknown. Among them, 86% or 1,538 had chronic illnesses. Those living in care homes, there were 1,047 cases, accounting for 58% of the total number of deaths. For the new death cases, 4 were reported by more of Department of Health, 2 male, 2 female. For these 4 cases, they were not hospitalized. and they did not go through HA's system. The age range is 56 to 89. Date of death, the 27th and the 23rd of February, and also a 28th of February for the 2 remaining cases. That's all from me. Dr. Lee, can you tell us what's happening with HA? There are 7,778 preliminary confirmed cases being treated in HA Hospital and North Atlanta Hospital and HA Infection Control Center, AWE Community Treatment Center. There are about 2,000 patients being in the community isolation facilities of Penny's Bay. We've reported 57 critical cases, 42 not vaccinated, 123 serious, among them 79 never vaccinated. 61 patients are being treated in ICU. In the past 24 hours, as at 00 hours, 150 patients have passed away, 96 male, 57 female, age range 35 to 105. For patients that have passed away, 97 came from care homes. 114 were never vaccinated or no such record were found. 25 had 1 jab, 13 had 2 jabs, 1 had 3 jabs. 140 was over 65-year-old. 6 are younger patients who passed away. I'd like to elaborate on them. 47-year-old female. She was bedbound in a convalescent ward in Princess Margaret Hospital. So she was infected with COVID, and her condition worsened. On the 5th of March, at 1:40 p.m., she passed away. The second, a 35-year-old female requiring renal dialysis for her renal condition. She had renal dialysis at Prince Wales Hospital. She was found infected with COVID, and her condition worsened. And on the 5th of March, she passed away. And the third, 52-year-old female living in a care home. On the 26th of February, she went to A&E, Department of Q&E, because of fever and shortness of breath, and then she was admitted. In the morning of the 5th of March, she passed away. Another one is 56-year-old male, a resident of a care home. On the 23rd of February, in the evening, he attended A&E of Bokoi Hospital because of SOB and cough, and he passed away on the 5th of March. The 5th case is a 51-year-old male who was suffering from terminal cancer. On the 24th of February in the afternoon, he went to the A&E department of Cornwall Hospital because of poor eating and deteriorated condition, and he passed away on the 5th of March. The last is a 59-year-old female with some mental illness background living in a care home. On the 4th of March in the morning, she went to the A&E department of Truman Hospital because of fever and cough, and then she passed away in the afternoon of the 6th. And all these she passed away on the 5th. She had chronic illness. So from the 24th of February to the 4th of March, another 74 patients had passed away, 32 female and 44 male, age range 24 to 105. 625 patients have been discharged. Bed occupancy rates 87.7%, and over 40 patients were found positive upon screening on admission, and 44 people in the same ward are now close contact. So far, 8,827 staff members have been infected, and 1,341 have returned to duties. Now, on designated clinics, tomorrow, the 7th of March, we will activate another 3 designated clinics. That makes number 17 to total to cater for the upsurge in the number of patients. Now, Tung East Kowloon OPD and Yu OPD and also Jockey Club in Tai Po. These are the three new designated clinics. As of the 5th of March, the 14 clinics have recorded 25,000 odd attendances.
The floor is now open to your questions. Please identify yourself and your media organization before you start your questions. The one on the left-hand side, I'm from cable TV. For 3 days in a row, instead of 50,000 cases, for 2 days in a row, we have got 30,000 cases a day. So are we seeing a downward trend? And then in relation to your talks with the private hospitals, what is the progress? In relation to the admission of non-COVID patients, are they able to get more? And what about admission of COVID patients? And what is their response? Is it a matter of difficulties with isolation, or is it a matter of difficulties in getting medicine? For Caritas Hospital, there has been a large amount of medical waste. What is the problem? Lack of manpower. And for Tek Long estate, they have identified over 2,000 cases. Is it too risky? Would there be a restriction and declaration restriction and testing declaration? And what about the complaints from those isolated at Chengyi in isolation facility? And they have been getting deep fried food and then the urinals, etc., very dirty. Let me first of all talk about the case of the Caritas Medical Center. Currently, indeed, for the number of patients admitted over the past few weeks, has been increasing all the time. The Caritas has been under huge pressure. Our staff members have been doing their utmost to clear the medical waste, but then the volume has grown by a number of times. We do have a mechanism to deal with it. We are getting qualified waste collectors to deal with it. We've asked the waste collectors to speed up the clearance of the medical waste, and in fact, we have asked additional waste collectors to clear the backlog. We have also added more facilities so that we can enlarge the capacity in relation to the storage of the medical waste. We will have close liaison with our contractors so as to clear the medical waste as soon as possible. For private hospitals, I hope you can appreciate that in the fifth wave, public hospitals are under huge pressure. I would like to appeal to the private hospitals to help us to take over more patients. As to our arrangements with them in taking over surgeries, 420 patients have been identified, and we're making arrangements. Cancer patients, radiography, procedures, and heart conditions, all of them will be taken up, and we are also getting more convalescent beds from them. Cumulatively speaking, more than 90 patients have been referred to 7 private hospitals for treatment. We'll continue to liaise with the private hospitals, hoping that we can ease the pressure on the public hospitals. As to the Chengyi Community Isolation Facility, well, as to the number of persons kept in a unit, and as to the other arrangements, please inquire with the Security Bureau. Dr. Au, for the trending, yes, for the past 2 days, we have seen a slight downward trend. Yes, the number of cases has come down a bit, but then it's still at a very high level, over 30,000 a day. We'll have to observe the trend for another week or two before we can say whether we have already peaked and then the number is coming down. As far as we can see, I don't think we are able to judge whether we have already peaked in terms of the infection. We need to observe it for a day or two more. Usually, over the weekend, the number of specimens as well as the number of positive result cases would come down, probably as this is because of the weekend element. For the past week or two, I think many citizens have been testing themselves using rapid test kits, and such figures cannot be reflected in our caseload, which is for the PCR test results. So we need to take all the factors into account. what we can see is that we have been covering buildings by having restriction and testing declarations, and then the number of positive cases is high, even up to 10 to 15%. So you can see that the infection in the community is still very serious. For the testing centers, yes, we have seen a lowering in the number of specimens, but then the ratio of positive results is still as much as 5%. So for a time being, I don't think we're in a position to say whether the infection has already peaked or whether the trend will go up again. So for the citizens, I will appeal to you to be on the alert as usual. For Tat Long Estate, we have locked it down for 5 days. We have identified many cases. For cases identified from RTD exercises, we will make speedy arrangements to send the residents to isolation facilities so that the infected cases will be removed from the housing blocks so as to lower the risk of infection. Well, upon completion of the RTD exercises, we will hand over the rapid test kits to the residents so that they can test themselves. If they are found to be positive, we hope that they will remain in their homes. Yes, the gentleman in the red sweater on the side. I'm from Phoenix TV. For the rapid test, I would like to know more about the reporting platform. It seems that it is still being delayed, but then for a day's delay, it means that more cases will be backlogged. So without the platform, how can you be accurate in knowing the trend of the caseload? Well, the launching date has been delayed time and again. Will that erode the public confidence in the government's efforts to fight the virus? Well, for the rapid tests, the rapid antigen tests, well, last week we said that this could be adopted and accepted as a way of testing. And if somebody gets a positive test, then it can be regarded as a confirmation and the person involved should stay home. We have already given an account about the progress. Everybody is trying hard to make the preparation. We are testing the system. Once the platform is ready, we will make an instant announcement, and there will be measures and guidelines for the citizens to report to us about their results of the rapid antigen test. Once the platform is launched, it means that we are in a better position to know about the number of cases in the community. That is the genuine caseload in the community. When we are ready, we will make an instant announcement or ASAP. Yes, the lady in the sweater with stripes. I'm from Hong Kong 01. Dr. Au, for the reporting mechanism for the rapid antigen test, what will happen? Do you report individually, or can someone report on a household basis? And then for the PCR reporting mechanism, it is said that SMS messages will be sent to the reportees, but will there be any follow-up action? And the media have reported that whether you are infected or not, you will be confined in AWE. The hygiene conditions there are poor. So will there be any risk of cross-contamination, and what is your countermeasure? Let me first of all talk about the case of the AWE. I think it's a matter of misunderstanding. There are 10 halls at the AWE. For the hospital authority, we have got halls 8 to 11. And then Hall 1 is on standby. For our patients there, they are all confirmed cases. Probably you are referring to the 4 halls. There is Hall 3 to 7, halls 3 to 7, being operated by the SWD. That's for the purpose of quarantine. So probably there is some sort of confusion about the arrangements.
As regards the reporting channel for RAT results, it is on an individual basis. So each member of the public, if he is tested positive by means of our AT, he can report his information through that platform. So it is not on a family basis. I hope people will not mix up with the platform for RAT and the platform for CUT, compulsory universal testing. So when the platforms are launched, we'll announce the details and including the procedures, and we will provide details by then. And another question is about the platform for reporting PCR results. It's been launched. Is in operation. Is for members of the public to, after receiving an SMS that he is tested positive, then there is a link in the SMS. You can click onto the link and report personal information, including address, date of sampling, and information of household contacts. They can be reported through the platform to the Center for Health Protection. Upon receipt of such information, we'll do a few things. We'll inform the departments concerned, anti-epidemic packs, including RAT kits and information and face masks and thermometer will be sent to all those reported, and we will issue a quarantine order for household contacts based on information uploaded to us. For instance, the identity of those living in the same household, and such information will be sent to these people for home quarantine. This gentleman here. Good afternoon. I'm from AM 730. Now for the restriction and testing notices, a few blocks at Kaiting Estate and Tak Long Estate issue. Does that mean that there is an outbreak there? And the Wache and Tin Long estates, now they're being restricted and tested. So are you going to cover all the estates block by block? And now for the person who was 24 and passed away, and also the patient who has had 3 doses and died. Some cases were not admitted. So will the number of deaths be announced by the Department of Health? Or is it these are the first time cases not admitted to hospital and are reported or announced by the Department of Health? Now there are over 20 plus community isolation facilities. I'd like to know whether the allocation is based on the location of the addresses. And the reporting channel or platform for RAT results, it is a week late. So at first you expected there will be over 100,000 cases. Will you adjust this figure because of the backlog? You mentioned 2 cases. One is a patient who has had 3 doses. I don't know what vaccine he had. He was a 31-year-old man living in Feng Yu King Hospital. He has hypertension, he had a stroke and suffering from Parkinsonism. Another case is a 24-year-old male who has had 2 doses. The last was administered in August last year. His family found that he was unconscious, so he was sent to the A&E department of Changguan Hospital in the morning. He had no history of long-term or chronic diseases. Well, on his way and to the A&E department, it was found that he had fatal arrhythmia, and that is fibrillation. So we tried to resuscitate by giving him a booster injection, and then he passed away on the 28th of February at 8-ish in the morning. Regarding restriction testing notices operation, now we choose locations and housing estates based on findings of the sewage surveillance program. The DSD and the EPD have boosted the surveillance program. So sewage samples are being collected from different districts of Hong Kong. Every day over 100 samples are tested. And they will also measure the viral load in these samples. We will select sewage samples with the highest viral load. We trace the source of such sewage so that we can very accurately tell where we could expect a cluster of cases or concentration of cases, and then we will launch an RTN operation to maximize our resources to identify positive cases. It's true that in our recent RTN operations, we've identified many cases, for instance, in Teck Long Estate recently, and then we will take follow-up action. When our CIF are more sufficient in number, we hope to arrange cases identified through RTN to leave the building as soon as possible, because if there are more than one case in a housing block, that means there may be vertical transmission or widespread infection. So to identify these cases and evacuate them is an effective way to prevent further spread of the virus in the building. So we're going to continue with RTN operation. When we have higher testing capacity, then even if the viral load in a sewage sample is not that high, we're still going to have RTN for a building with positive, with sewage samples tested positive. Well, every day we have a system to cross-check with the HA to find out patients who pass away upon admission. So if the deaths are within HA's system, we can cross-check with HA and new cases can be allocated a case number. Another channel is the public mall of the Department of Health in carrying out a forensic examination. If positive cases are found, they will report them to CPH, and so we will consolidate them and then report to the public the latest number of deaths. As regards CIF, the allocation of CIF is done by the Security Bureau. When we have a positive case, the first thing to do is to, through our online platform, see whether the case has reported information to us. If the answer is yes, then we've got his address. And you might have noticed that we ask questions on our online platform. The home environment is a primary consideration when it comes to whether he should be admitted to a CIF and whether there are risk factors, whether he is an immunocompromised person and whether he can take care of himself, or will there be carers at home. And then we will come up with a list of cases suitable for CIF to the Security Bureau for allocation. The actual allocation of CIF is done by the Security Bureau. Among cases received every day, we check whether with cases that should be admitted to hospitals instead, and the information will be passed on to the hospital authority. So unless the case require looking after and is not suitable for CIF. Otherwise, most people are suitable for CIF, and we hope to arrange them to CIF as far as possible to lower the risk of transmission in the community.
The one in black in the middle. I'm from Now TV News. Just want to follow up on the HA, that is cooperation with the private hospitals to take over patients. I want to know whether the outpatient clinics of the private hospitals will take in COVID-19 patients, other than referring the non-urgent surgeries to the private hospitals? Are you going to refer COVID-19 patients to them because they still have capacity and there is a long queue of such patients? Would you do that to ease the pressure on the public hospitals? And then for the RAT platform, can you give us a rough idea as to when it will be launched? Would it be in the coming week? Can you be more specific? And then for the criteria for making restriction and testing declarations, we have got so many hidden patients. And in fact, we have got many positive results in the sewage surveillance exercises. Are you going to expand the area covered by the RTDs so as to identify the transmission links? For the private hospitals, they will take up surgeries, convalescing patients that are non-COVID-19 patients, but in fact they have also take up some COVID-19 patients from us, like in the case of the TMHK. They have got 24 beds for mild cases, and it has been started. For the RAT reporting platform, we are now at the stage of testing the platform. Basically, it has been completed, but we do hope that when we do launch it, the system is sound and intact. Therefore, we would like to do more to make sure that the platform will be fine without any problems. When we are ready, we will make an announcement immediately, and then we will give an account as to how the citizens should make use of the platform and what to do when reporting. And there are also priorities in terms of making the report. I don't have details for you because we haven't finalized everything. For the RTDs, as I have said, one of the criteria being the positive results of the sewage surveillance exercise. And of course, we'll try to screen the areas, and we will make RTDs for areas with the highest viral load in the sewage. In fact, we have got a systematic way to collect the samples of the sewage. When the sewage surveillance yields a positive result, we are able to trace the origin of the sewage, like the district, the area, or the building. So we would like to be more focused. We would like to be specific. We would like to go after those with the highest level of risk instead of blindly going around and cover a large area. Let's take an English question. The one in the second last row.
SCMP News. I would like to ask, just now earlier, a top mainland expert said that Hong Kong public hospitals should designate around 30 to 50% of beds for COVID-19 patients. Are there any plans for that? And if yes, what is the expected time frame? And also, how is the HA handling existing patients at COVID patients-only hospitals at the moment? And secondly, just now earlier, the Chinese Vice Premier has said that private hospitals are not doing enough to help with the COVID fight. And earlier, Dr. Larry Lee, you've mentioned you're trying to appeal to private hospitals to help more. And since the fifth wave has broke out for a while already, why is it, taking so long to enhance this type of cooperation with private hospitals? Is there some kind of resistance for private hospitals to accept more COVID-positive patients? And my last question is on PCR tests for private contractors. How many PCR tests are they performing a day, and what is the maximum capacity for private contractors to do PCR tests for one day? Thank you.
Okay. For the hospital bed, you may learn that our existing capacity, which is the isolation facility, will be around 3,600, and now we have more than 7,000 cases, which is in our public sector. So we have to numerous measures try to increase the capacity of to accommodate the increasing number of the COVID patients. So other than the tier 1 and the tier 2 bed, and actually we are working out a full speed and try to elaborate on the general ward. As I mentioned before, we try to install the fan and also to enhance the engineering, try to make sure a safe environment for to capacitate the COVID patients. And now we do it as soon as possible and towards the directions to 50%. Public hospital, we always in a close liaisons with the public sector in helping out the patients. And I think for the COVID patients, we've been under the explorations. We've been under exploration with some private hospital, and especially I talk about the TMHK Medical Center. And actually, we are at the very last bit of the negotiations, and I think that can be start operation very soon. And on the other hand, I think we keep a very close communication with them to try to help our hospital more because our strategies before is because we have to make sure some designated hospital to be operated to receive the COVID patient, and therefore the chronic patients and also the convalescent patient right there need to be accommodated. And actually, private hospital has contributed to accommodate these patients.
For the private contractors, I don't have the most updated data on my hand, but several days ago, the private laboratories are doing something around 200,000 specimens per day, including up to more than 120,000 coming from specimens from the community testing centers or mobile testing stations, mainly for those put under as compulsory testing, and also for some targeted groups. And also quite a number of private contractors are doing specimens for the restriction testing and declaration operations.
下一位，呢邊呢位男士。
Yes, the gentleman over there. I'm from Dot News. I want to know about the maximum capacity of testing in Hong Kong and what is the ratio of positive results. Do you have the statistics? And then you have got restriction and testing declarations. For those who have positive results will soon be taken away. But then for those who carry out a test themselves, they don't get any follow-up action. So can you tell us more about the criteria for the differential treatment? Last Tuesday, we have the Chengyi facility being commissioned, but then so far only 72 patients were admitted to that cabin hospital. What is the difficulty? How come that it is not put to maximum use? There are just so few patients there at the moment. Many media reports have said that for citizens trying to call the government using the helpline, they never get through. So do you have ways to make improvements to help them? And then finally, our readers have said that for some hotels, their citizens could go to hotels to carry out their isolation or quarantine. So hotel rates are going up. Have you noticed such a phenomenon? Are you going to impose any guidelines? Are you going to have any follow-up action?
關於個社區檢測
concerning the number of testing capacity, private labs are doing close to 200,000 samples per day. The peak could be 300,000 per day. We have a dozen or so private laboratories in Hong Kong. Their testing capacity, they've almost reached a saturation when it comes to their testing capacity. I understand that the Food and Health Bureau has been following up with private laboratories to see how their testing capacity can be further boosted. Now, in our community testing centers, the percentage of positive samples remain at a very high level. In the past, over 4% of the samples were tested positive from community testing centers, and the percentage of positive samples in RTD close to 10 to 15%. Well, when positive cases are found in RTD operations, hopefully they will be arranged to stay in CIF the next day. The allocation of CIF is done by the Security Bureau. Now, usually if someone can look after himself and is aged between 18 and around 70 with no special care needs, then they are suitable. Every day when we have new cases, when we are aware of the information, we will pass them to the Security Bureau, which will, through its existing mechanism, arrange for suitable persons to go to different CIF. As for hotels, we do not encourage any confirmed or positive cases to stay in a hotel for isolation. Now, anyone who's tested positive should stay in their own place or wait for government departments to arrange for him to go to isolation facility. After all, hotels are not the best place for isolation. If need be, whether a hotel is suitable for quarantine or isolation purpose will be decided by government departments after checking their infection control measures and ventilation facilities. So all quarantine hotels have been subject to inspection by government departments, and they also have to put in place a number of measures to prevent the transmission of the virus within the hotel. If all criteria are satisfied, then they will be drafted by the government to become designated hotels or quarantine hotels. Hotels that are not designated hotels or quarantine hotels, well, they are not advised to be used for isolation because that can increase the risk of an outbreak in the hotel. Next, this lady over there. I'm from independent media. So some hotels will be used as isolation facilities, but there may be long stay residents or guests there. Have you considered this? We've got so many cases. Do we still need RTN operations and the online reporting platform? Do you expect that it can be launched within next week? The first, on the choice of isolation hotel, this is the duty of the Food and Welfare Bureau. I don't have such information. And as for the reporting channel or reporting platform, we are now at final stage. We are testing the platform. I can't pin down a particular launching date. I hope that by the time it is ready, we can launch it so that members can report their positive results to us so that our system can be better. As for RTN, our policy now is early identification, early isolation, early treatment. The community is still in an outbreak. There are cases in many districts and many buildings. There are plenty of transmission chains in society. But we know that there are some more focused transmission chains, and they are identified through our sewage surveillance program. If the viral load in a sample is very high, that means there should be plenty of cases in that particular housing development or building. So RTN is still a very effective way to identify cases for follow-up action and isolation. This lady on the far left. Good afternoon, I'm from Mingpao. We have so many patients in the community, but then the facilities in Tsingyi Cabin Hospital and Penny's Bay, they are still not full. How come so few people have been arranged to stay in CIF? Is it because of your coordination with the SB? I'd like to know whether the percentage of patients that require resuscitation has increased, and how has that affected your manpower and A&E department? How will you boost support for A&E staff? Will you deploy staff from other wards to help? Dr. Au, you mentioned 4 deaths without admission to hospitals. Can you provide us with more details? For instance, were they tested before they passed away, or was it because they could not be admitted and so they deteriorated at home and passed away subsequently? So for the reporting platform, is it being done by OGO or is just by the Center for Health Protection? Has OGO given you any support? Whether we are talking about Penny's Bay or Tsingyi, now medical aspect is being done by the HA, and allocation to or placement to these facilities are done by SB. A&E departments are the front line of our healthcare system. They are under great pressure and very grateful to them for working day in, day out, and their workload is very heavy. And we are trying to help our A&E departments through various levels. First, on the turnover of patients, as mentioned, we will open more beds as far as possible. We hope that we can add about 50% more beds. And when patients are stable and fit for discharge, then we hope the turnover can be increased. Whether patients are in wards or in A&E department, if they are stable, they would directly be transferred to CIF or community treatment facilities. Different clusters are now deploying doctors and healthcare manpower to help out at A&E department. As for placing confirmed cases to CIF, the FHB, FSC, and SB and CHB maintain very close liaison. Now, when we receive a new case, information of a new case, we will screen out cases suitable for admission to CIF. The checklist will be passed on to the Security Bureau and the FSD. We do have some screening criteria. We will give priority to newly tested positive cases and not the older cases. That is, sampling was done in the past 3 days, and age within the range are suitable for admission to CIF. And of course, the case will not have any need for medical care. But as we all know, there are so many cases, and it's impossible to make arrangements for each and every case. So we have another level of screening. If the home environment is not really suitable for home isolation, then the case will have priority. I hope members of the public can cooperate as far as possible. If you are a positive case or confirmed case and you receive information that you will be admitted to a CIF, please respond and try to comply as far as possible. Under CAP 599, Prevention and Control of Infectious Disease Ordinance, the government need to arrange patients with infectious disease to stay in isolation facility. So we ask for cooperation from members of the public. Now we receive 4 cases reported through the mall of Department of Health. They passed away earlier, and When they arrived at the mall, they were found to be positive to COVID. 4 cases were involved, age range 56 to 89. 3 had chronic illnesses. Our preliminary understanding was that before they died, they displayed symptoms. They passed out at home, and upon arrival, they were found dead. And the dates of death were 23rd of February, 2 on the 27th of February, and 1 on the 28th of February.
For the online reporting platform, we are at the final stage of testing. But once it is ready, we'll make an announcement. Here's the lady in the last row. I'm from Ta Kung Pao. For the Chingy Cabin Hospital, I know that 3,900 beds are available for mild cases. And then another place can provide 1,300 beds. I want to know how many patients have been admitted. I know that altogether they can provide 5,000 plus spaces. I want to know whether the hospital authority is making full use of the 2 facilities. For the care homes for the aged, they are in a very serious situation. Are you going to give priority to move the elderly people to such facilities? Yes, you talk about the Chingy Community Isolation Facility as well as the Queen's Hill Facility. They are community isolation facilities for mild cases. As I have said, the hospital authority would only man the medical post. We only provide the medical service. For other details, you need to follow them up with other government departments. Let's take the final question, the lady on this side. I'm from TVB News. Just now, it has been said that for patients referred to private hospitals, they are mild cases. For mild cases, I want to know whether there's no need for them to be admitted to private hospitals. Rather, I think it's better to refer those who are waiting at the A&E departments to the private hospitals. And then there are 4 cases of death not reported through the HA. One of them didn't have any chronic diseases. What about the vaccination status? Was it a matter of being admitted to hospital too late and so the patient passed away? For the low occupancy rates at the cabin hospitals, I want to know what's the problem. Is it a matter of poor coordination or lack of manpower, or is it being taken by the SB and you cannot intervene? Let me first of all talk about the community isolation facility. We provide medical assistance. That's our role. I believe that all the time we have been providing such a service, and I don't think there's any problem with manpower. Let me come back to the question of private hospitals. Maybe I misunderstood some of the questions. For the CU hospital, we are at the final stage of negotiation. Very soon we're able to commission the service. 24 beds will be available for mild cases. Let me elaborate on the arrangement. You may wonder why mild cases have to be hospitalized. Well, in fact, they may have a medical background, like suffering from diabetes or other chronic illness. In this case, there is a need for hospitalization. But then for our hospitals, we'd like to keep the capacity for other patients with other needs. So it's better for such patients to be treated at a private hospital. And if they stay in the community, we may not be able to provide the medicine and other help. For the cases reported from the mortuaries, one of the cases didn't have any chronic disease background. He was an 89-year-old man. He was found to have passed away on the 23rd of February. According to information we have got, the patient did not have any vaccination record. And according to information we have, he didn't have any underlying conditions, but then he did have symptoms. On the 23rd of February, he passed out at home. He wasn't admitted to any hospital because he was found dead at home. When the autopsy was carried out on his body, it was found that the COVID-19 test was positive. That's all I want to supplement. And just now, there was one point I have forgotten to mention. As in relation to the development of the rapid test online platform. Well, the CHP is the user. We are grateful to the IT team of the DFH. They have been working round the clock to develop this platform. And from the logistics office of the OGO, they have also provided technical assistance to us. So it is a matter of the joint efforts from different disciplines. Let's hope that it will provide a convenient route for the citizens to report their positive test results to us. That's it for today's press conference. Thank you.